That's been a frustration for a long time, trying to diagnose lung cancer early enough to do something about it.
There are some new and exciting developments in the worlds of detection and treatment, and the hope is they could save lives.
That's right. Dr. Marcus Balters is here. He's a cardiovascular and thoracic surgeon with CHI Health's Lung Health Center. Thanks for stopping by, Doctor.
Oh, thank you for
So help us
having me.
understand this a little bit. We know it's important, but why is the lung screening so critical?
So one of the problems with lung cancer is, you have a lot of space in your chest, and lung cancer starts small, and it oftentimes takes a long time for someone to notice that they have a problem. By the time they're diagnosed, many times it's advanced, and so early screening is important to try and get early detection.
You say a long time to notice. I mean, could this be developing over the course of years? Is it?
Yeah, absolutely. Months to years. You can start with a small nodule that grows slowly, and it can take months to years before you see it, and oftentimes you don't see it on chest x-ray until it's fairly large.
Losing precious time all
Absolutely.
along. Tell us about the Lung Health Center. How does it work to the benefit of patients?
Sure. So the Lung Health Center is designed to try and bring all of the issues that you need to diagnose and treat somebody into one location. Many times if somebody gets diagnosed with a nodule, then they have to go to their doctor, then they get referred to another person, then they get a test, to get a diagnosis, then they get sent to a surgeon. So it's a drawn out process, whereas the Lung Health Center is designed to have everybody in one place. You come in, you're seeing multiple specialists, look at your information, help determine what the best course of action is.
It's really set up to streamline the whole process because, like you said, the timing is critical.
Absolutely.
It can take as little as 2 days,
Yeah,
I've read.
Yep, we are definitely trying hard to get people in within 2 days. We don't always have a definite answer within 2 days, but we very much are trying to get people set up to do the tests they need to do to get the answer and then decide what is the best course of action, whether it's observation, surgery, biopsy, whatever it might be.
We're taking a look at the website, lots of important information on there, but one of the things you also brought in is some sort of tool. I'm not sure how you use it,
Sure.
so an explanation would be good, but this is kind of an example of state-of-the-art technology that assists you.
Yep. So this is a stapler that we use for lung surgery now. Traditional lung surgery has always been done through a large open incision, but now we're doing something called a VATS lobectomy, where we're trying to go through small incisions. We introduce a stapler inside, we open it up, and we're able to angle it within the chest, for example, and then staple across to get the lesion or the piece of lung out that we need to remove.
So it's less invasive
Absolutely.
than traditional
Absolutely.
methods? Oh gosh,
We
and
have a
here's some
picture here,
pictures that show that.
Yeah, so on the left side of the screen you see a traditional open operation. That's a pretty large incision,
And that's,
nearly.
is that a torso? Is that what we're
Yeah,
seeing?
that's
inside
sort of the back side of a chest.
Yeah.
Okay.
And on the right side of the screen you see 3 small incisions that are used for the minimally invasive approach. So it really makes a difference in terms of recovery. Early on there was some questions about is the small incision operation as good of a cancer operation? But studies have shown it definitely is.
And this is video, you said VATS, what, video assisted?
Thoracoscopic surgery.
Okay, and so that's where we are today, and we can see how the they're not taking as long to heal, they're not as sore after the fact.
Absolutely.
You're able to be accurate still with this device?
Absolutely.
We get all that.
Recovery's faster? Does it
Recovery
reduce?
rate's faster, the risks are lower, the cure rates are equivalent, and some studies are even saying they may be better than the
That's
traditional
huge.
open
I think it's
operation.
important to kind of address risk right now with lung cancer. How do you know if you're high risk or what your risk level is?
So 95% of lung cancers are associated with smoking. So really the Medicare, Medicaid has just decided that they're going to start paying for screening to try and reduce late discovery of cancers and instead try and find things early. So I think we have some criteria on the screen that talk about what features you might want to consider calling to be evaluated for a screening process.
So the age range there, 55 to 77, that's where typically you'd see more cases
That's
than
correct.
outside of that range. Of course, if you are a smoker today or you've quit within the past 15 years, to this next point, what do you mean, at least 30 pack years?
So-
Define that for us.
Sure. So lung cancer risk increases with more pack years. If you smoke a pack a day for 10 years, then you have a 10 pack year history. So if you smoked a pack a day for 30 years, that's 30 pack years. Or if you smoked 2 packs a day for 15 years.
I see.
Gotcha.
Do the math on
That
it.
makes sense.
And then if your physician has said, I think you should be screened.
Yeah, absolutely.
Get screened. Is the screening itself complicated?
No, it's called a low-dose CT scan, and you get a CAT scan. Really, the thing that has to be understood by people is that we'll want to follow you if we see a nodule or an abnormality. Doesn't necessarily mean that you have cancer. A large percentage of people who smoke will actually have something in their lung, but it isn't necessarily cancer.
We just dealt with this. My brother, who has smoked for years, just a few months ago, doctors found a spot on his lung. They came back, they said it's not cancer, but we want to keep an eye on it. But I think that's important for him as a husband and a father to understand that there's something there, to be informed about it, so that you can take action at a point if it's ever necessary. But you have to know the spot exists in order to know to do something about it.
And that's where the screenings come in, right? So the screenings, how do people go about getting screened? I know you got the website, and we had all that information on the website. What's the first step that our viewers should take?
Well, you can talk to your primary care physician, or we have a number, I think it's 717-LUNG, L-U-N-G.
So you can call on your own. You don't need your doctor to help refer you.
That's correct.
Great.
That's very correct.
And again, this is a local facility, and the point here is to streamline it so that as a patient, you're not waiting as long. It's still accurate, and you're able to get to the bottom line faster. And it's about saving lives, ultimately. That's the point of it all.
It is, yeah.
CHIHealth.com/lung-center.
Doctor, thanks for your time this morning.
Thank you
Great to
so
meet
much.
you.
It's really a
Yeah,
pleasure
great
to be here.
information.
Nebraska born and raised, by the way. in case
From
you
Lincoln,
wondered.
Nebraska. Come on, Lincoln Southeast, right?
That's right.
Give 'em